Hi, my name is Earl. I'm an LVN and currently working with inmates at Men's Central Jail in downtown LA. I chose the topic of ACL injury and its treatment because I want to share what I learned about it while going through this injury that happened in January this year. An ACL tear or injury can happen to anybody, not just people who are active or those that play sports. It could happen anywhere, whether it's at home, workplace, gym, or park. But the good news is it is repairable and anyone can get back to their old lifestyle if the treatments are done properly. An anterior cruciate ligament or ACL supports knee functions and movements. It is one of the most important ligaments connecting the bones of the knee joint. To connect a bone to another bone in the knees. The function of ACL is to provide stability to the knee joints and limits the movement of the lower leg bone, which is the tibia, in relation to the thigh bone, which we call the femur. An ACL injury can be a complete or partial tear of the ligament. It could result from hitting the front or the side of the knee, hyperextending the knee, or sudden pivoting of the knee. This is where where you can find the ACL right here. It's in the middle of the knee, right there. This is the one that breaks when you say you tear the ACL. Usually the main complaint or symptom is it feels like the knee is going to buckle or give out. At least for me, that's how it felt. ACL injury can be treated with rehabilitation or surgically reconstructing it. While playing basketball during my weekly pickup games with my friends, I drove towards the basket and shot the ball. I missed, so I went after the rebound. I jumped, then landed on my left heel first instead of the front part of the ball of the foot. As a result, I hyperextended my left knee. I fell on the floor, and for about a minute, I could not get up because of excruciating pain. The following day, my left knee was so swollen, I could not bend it or bear weight on it. After a subsequent visit to a sports medicine doctor, orthopedist, and an MRI, it was found out that I have a complete tear of the ACL. I was given a choice to have a surgery done or to do rehabilitation only. I chose to have it surgically reconstructed because I wanted to go back to playing basketball. Treatment such as surgery or rehabilitation depends on each person. An ACL reconstruction, according to the orthopedist that did the surgery on my knee, is not an emergency procedure. That some people tear their ACL and did not have any surgery at all and opting for rehabilitation instead. Surgery is not for everyone. For someone that does not have an active lifestyle, those that play sports or their work not requiring lifting or other strenuous work need not to have the surgery. Those who choose to have surgery done faces months and up to a year of rehabilitation that requires commitment. A person should also consider their activities if these are going to be affected by the injury. If their knee constantly buckles and risk of injuring it furthermore, then surgery might be required. For those high-paying athletes playing professionally and keeping their body fit is their main tool in earning a living, a surgery as soon as possible is required by rehabilitation so they can get back to playing right away. There are usually 3 kinds of tendons used to replace the torn ligaments. Each has its own advantages and disadvantages. Patellar tendon graft is harvested from a patella. According to Guy Slowick and Dr. Bernard Bach from an internet site eHealth on April 2013, this is what they call the gold standard choice for the ACL reconstruction, meaning this is the widely used technique. Another one is hamstring graft procedure, which is harvested from hamstring. Last one is tendons taken from a cadaver or deceased person. At the end, it all varies from patient to patient. Surgery is an outpatient procedure, which means patients can go home the same day of surgery. Exercises to strengthen the knee starts the same day. A physical therapy session is scheduled for rehabilitation. For people who choose not to have surgery done, rehabilitation to strengthen the muscles supporting the knee, such as the hamstring and the quadriceps muscles, is the option. People that are not active can live without ACL as long as they have strong hamstring and quadricep muscles. This can be done with physical therapy sessions. According to a study done by Frobel, Roos, Romer, Ranstam, Lohmander from the Department of Orthopedics Clinical Sciences Lund University, all patients received similar structured rehabilitation. In addition to rehabilitation, 62 patients were assigned to early reconstruction, and 59 were assigned to the option of having a delayed ACL reconstruction if needed. In this first high-quality randomized controlled trial with minimal loss to follow-up, a strategy of rehabilitation plus early ACL reconstruction did not provide better results at 5 years than the strategy of initial rehabilitation, with the option of having a later ACL reconstruction result. Did not differ between knees surgically reconstructed, early or late, and those treated with rehabilitation alone. These results should encourage clinicians and young active adult patients to consider rehabilitation as a primary treatment option after an ACL tear. For people that suffer this injury, there is a treatment that will suit each person's lifestyle. This injury can happen to anyone, anytime, as I have learned from talking to other people who had the same injury as mine. After an appropriate treatment is done, and by committing and investing time on it, a person can go back to normal activity just like before the injury.